Today I have a male patient who flew in from out of town. He's going to get liposuction today for body contouring. Now he has multiple areas that he wants to address. He wants to have his chest, he wants to have his arms, his torso, including his front and his back, and he's kind of looking to lose the weight. He's been working out and exercising, but he needs just a little bit help to get there. For most patients though, patients like to go home or just stay in a recovery center for one night, so we like to keep the liposuction to 5 liters or less for maximum safety. For patients who want more than 5 liters taken out, then we plan for large volume liposuction. And these patients usually have to stay over in a medical facility, such as a hospital or a surgical recovery center, so that they can be taken care of medically, because it is a lot of stress. They might need extra fluids. They may still have a Foley in. So for this patient, we're going to actually stage his procedure. He's already lost 5 pounds. We're gonna do some liposuction of the torso and then come back later after he loses some more weight to do some liposuction of his chest and arms.